Hi, today I'm going to talk to you about EMDR. You might have heard about EMDR in the media. There's been more reporting on it recently. It's actually been around for a while, and it's a kind of therapy that was originally used for trauma treatment, but now it's been found to be helpful for all sorts of things, including anxiety, which could be kind of generalized anxiety, or it could be anxiety in relation to something like maybe having to give a speech or performance. It's also useful for grief, so I've worked with people experiencing grief, and it's allowed them to move from a place where maybe the end times of being with someone dominated their thoughts about that person to a place where actually they could remember the whole of their time with that person more clearly. So it can really shift things. What does EMDR stand for? It stands for eye movement desensitization and reprocessing, because often therapists will use a sort of left-right movement following their fingers, or a light on a light bar to allow your eyes to move to the left, to the right, maybe in other patterns. And for some reason, we don't know exactly why, that helps the brain to process through old, unprocessed stuff. We don't just have to use eye movements though. So we can also use taps. So this is the butterfly tap, or we have pulses that you could just hold in your hand and they kind of vibrate a bit like a video game controller. We also use sounds, so you can have a left, right clicking sound. You can also use body movements, even walking triggers it off. And in fact, that's how EMDR was discovered. Francine Shapiro was mentally hitting a brick wall, finding it really hard to think through stuff. So instead, she went for a walk, and she realized that when she went for a walk, suddenly her thoughts were coming more clearly. And being a psychologist, she sought to find out what was going on there, and that's the foundation on which EMDR was built. And pretty much anything that has a left-right movement can facilitate processing. So in work with children, we might encourage things like rollerblading, roller skating, ice skating, painting, and there's no reason why that's not valid to do with grown-ups too. It's just that kids get to do the most interesting stuff first. What can EMDR treat? So originally it was developed as a treatment for trauma, so post-traumatic stress disorder. And you can have a simple trauma, which is one specific incident that's quite clearly traumatic, so something like a road traffic accident, where that experience has kind of stayed with you. You might be experiencing flashbacks or nightmares, or feel like you're kind of being pulled back to that event when certain triggers happen in the here and now. So that's an example of what they call a simple trauma. It can also help with more complex traumas. So complex traumas tend to happen over a longer period of time. They might have happened a long time ago, perhaps in childhood, but your therapist will help to assess what kind of trauma there is and then make a plan with you. EMDR has also been found to be helpful in work with anxiety. So it could be sort of generalized anxiety or anticipatory anxiety. If someone thinks that something's coming up in the future and they're kind of fixated on it, it can help to process any fears that they might have in relation to that thing that's coming up, and then feel more relaxed, more confident when it comes up. I've personally worked with people who have aerophobia, so fear of flying, and what you can do there is kind of think, okay, so in the past there were these events that happened and they contributed to it, so you process through those. You could then think about triggers in the present, and if someone has a almost worst case scenario, we do what we call a flash forward, and that is thinking of this sort of doomsday scenario, making it really clear and then processing that, and then thinking about a scenario where things are coming up, but the person is able to just get through it, kind of reassure themselves that everything's going to be okay. And again, process through that, and that tends to help to reduce the anxiety. You can do flash forwards for all sorts of anxieties, traumas, phobias, and it tends to work to kind of reduce that fear of, oh, I feel okay now, but what about in the future if something comes up? EMDR is also fantastic for working with grief or bereavement or loss. So sometimes people describe how actually when they think about a person who they've lost, all they can think about is what happened at the end, and that's kind of blocking them being able to remember their entire time with that person. So what EMDR seems to do is allow processing of the end stuff. It doesn't wipe any memories, doesn't get rid of any information, but what it does is it turns a memory from something that feels like it's very much sort of happening again when that person thinks about it, to it's just something that happened. I can go there if I want to, but actually it's not like a whirlpool pulling me in, and I can go to other bits of my memories with that person as well. So it can really help to shift things. Interestingly, EMDR also works in working with pain. So some people with chronic pain find that EMDR helps them to kind of shift how their body feels. It's almost like it kind of recalibrates the physical side of things too. And EMDR is classified as a somatic therapy, so it works on the body, not just on the kind of the mental side of things. For all of these reasons, EMDR is great for working with the impacts of having a long-term health condition. So that might entail having certain treatments that are aversive or changes in the body, and EMDR can help to process through that, almost recalibrate those physical sensations and help people to not be thinking so much about the past, but be able to be in the here and now and not have such anxiety about what may or may not happen in the future. So what happens in EMDR? So the first stage is kind of meeting a prospective therapist. They'll work out what's going on for you, so they'll do an assessment and think about those touchstone events, or there might be one really clear event that you want to work on that just keeps coming back. Then things in the present, so that could be triggers, things that take you back to the event, make it feel like it's happening again. And then symptoms, so when that triggering happens, how do you feel? How does your body feel? How do you feel emotionally? Also thinking about in the present, if you have a kind of flash forward to doomsday scenario, they'll help you to work out what that might be and make a plan for a potential bit of flash forwards work to help to address those anxieties about the future. They'll also help you to put what we call resources in place. So resources could be things like relaxation techniques, grounding techniques. One that we often use is called the safe place, and that's an imaginary place that you can go to. It could be based on a real place that you've been to, but essentially it's a place you can go to in your mind, like a beach or a forest or a natural scene that feels safe, calm, relaxing. And they'll use some eye movements or tapping to really embed that safe place. And just doing that can be quite transformative for some people. So it can give that sense of wherever I am, if needs be, I can go to my safe place and things aren't as scary anymore. So once the assessment's taken place and you've got those resources in place, processing can begin. That involves just thinking about the memory and then doing the eye movements. Obviously there's more to it than that. There's no need to go into it in great detail. And often what I say to people is it's usually best once you've done all the preparation and it's okay to continue, it's best to just give it a go, see what comes out of it. People can sometimes be surprised with how rapidly change can take place. So especially compared with some other kinds of therapy, you can get quite rapid changes in a small amount of sessions. And that, again, can be quite liberating for people. And a really important thing with EMDR is that you're in control of the processing. It's your brain that's doing the processing. And in fact, you don't even need to tell the therapist all the details of the memory that's being processed. So if you're anxious of not wanting to share certain stuff, you don't have to. There's kind of ways of doing it that we call blind to therapist. And all you need to do is tell the therapist it's changing, it's not changing. And that's enough for the therapist to be able to keep that processing going and for the healing to take place. What people describe happening over the course of EMDR is that a memory that once felt very much alive and almost like it was still happening transforms into just being something that happened. They can go there if they want, but there's not all this kind of associated distress, discomfort, physical sensations. They just feel it's just something that happened. One metaphor that we sometimes use is the idea that when something happens that's traumatic and it feels like we're out of control of it, it's almost like our brain is so flustered, it's just trying to survive and get through, that it just chucks all the information, all that raw data from that memory, throws it in the cupboard, which kind of works, you know, it's in the cupboard. However, if anything then triggers you and reminds you of that memory, it's almost like the cupboard opens up, all that stuff falls out again, and it just feels like it's happening again. So with processing, we're getting close enough to sort of open the cupboard, take stuff out, just neatly fold it up, package it all up, place it back in. And then in future, if it's triggered, then it's not like everything just flies out of the cupboard and it's overwhelming. Actually, you can see, okay, that's that thing that happened, but it's not in control of me. I can choose to go there. I don't have to. Another interesting thing about EMDR that's become more kind of prevalent, especially since the COVID pandemic, is that you can do it face to face. And I think it's always good, if possible, to do a session face to face in the early stages. But you don't have to do it face to face, so you can do it all online. And in fact, my initial training was totally online. And at the time, I was a little bit skeptical. I thought, how could something like this work online? But actually, it works great online. So if for any reason you find it difficult or impossible to see the therapist of your choice face to face, all is not lost. You can do the sessions through video conferencing, and it works great. It works just as well. And there's software that can do the moving visual kind of dot, but there's other ways you can do it. So yeah, online, face to face, both work great. How do you find a therapist? I would recommend going to the EMDR UK directory in the UK. EMDR Europe in various areas have their own directories. But in the UK, the EMDR UK directory has accredited therapists. So they've all got experience, they've all got practice, they've all been assessed. So they have proven levels of experience and competency. I am an accredited EMDR therapist. So yeah, obviously I'm an option, but there's loads of EMDR therapists out there. So you can definitely find the therapist who feels like the right fit for you and is convenient for you to see. So I hope that demystifies EMDR a bit. If you have any questions, put them in the comments. And if you found that helpful, please like and subscribe to this channel. And my next video will be up there, I hope. Thanks very much.